Hello, I'm Claire Foster. I'm Professor of Psychosocial Oncology and Director of the Centre for Psychosocial Research in Cancer in Health Sciences. And my research programme focuses on understanding the impact of cancer and its treatment on people's everyday lives, and using this information to create resources and inform improvements to health service so that the lives of people affected by cancer can be improved. And when we're talking about people affected by cancer, this is from people who may have a family history of cancer, who may have a genetic predisposition, through to people who've had a diagnosis of cancer and may be undergoing treatment, so that we're interested in understanding all aspects of life that are impacted when people are affected by cancer. And we're doing this through large-scale UK-wide cohort studies, as well as smaller qualitative studies where we look in depth at particular areas of concern for people affected by cancer. And as I say, we're using this information to develop resources, and we work very closely with patients as well as a wide range of stakeholders in healthcare and in the charity sector, as well as policymakers. And we've developed digital resources to help people gain confidence to manage some of the problems that they may experience as a consequence of cancer. So one of the key findings from our UK-wide cohort studies is that people who are experiencing depression or have low confidence to manage illness-related problems are more likely to have poorer health and well-being experiences in the months and years following their cancer diagnosis. And this is really important for us to understand because it's something that is amenable to change. So it's important that we identify those people who have low confidence to self-manage, as well as who are experiencing depression, so that support and interventions can be implemented whilst people are having their treatment to help them to live with and manage low confidence and depression. And this is likely to help them have improved recovery experiences in the months and years beyond their diagnosis. So throughout our projects, we work with a number of stakeholders, and we do involve policymakers and people in organisations such as Public Health England and the Department of Health and Social Care, as well as within the university, within Public Policy Southampton team, so that we're very mindful of how we need to present our research and findings to appropriate people as we go through our research, so that when we do have our research findings, we're ready to present those findings in an appropriate format. So in some senses, we've had quite a lot of support from Public Policy Southampton in terms of developing policy briefings and so forth. Most recently, we've had a really exciting and interesting experience whereby Public Policy Southampton encouraged us to submit evidence to a consultation from the House of Commons Health and Social Care Committee, who were looking to review and look at evidence of cancer services across England. And we had a great deal of support because this was something new to myself and my team in terms of how to develop such an evidence document. And we had particular support from Wasim Debouk, who was a policy research fellow working with Public Policy Southampton, who helped us to shape the evidence, which was then submitted for consideration by the Health and Social Care Committee. And then following that, I had an invitation to provide some further evidence to one of the expert committees that were independent to the Health and Social Care Committee, again looking at cancer services, and we submitted an evidence document to that expert committee, and those reports are now in the public domain, and the evidence that we submitted is also in the public domain as evidence alongside that report. Our evidence was particularly important for the element of the consultation and the report which looked at people living with and beyond cancer. And our evidence highlighted the importance of supporting people through personalised care to enhance their confidence to manage, as well as addressing mental health concerns. And the report picked this up and indicated in their report that services were not yet adequate in supporting people through personalised care in managing what mattered to them. And for us, those things are around the psychosocial aspects of care, so their mental health and confidence to manage. Throughout our programme of research, we work very closely with a broad range of stakeholders, including third sector organisations such as Macmillan Cancer Support, and we support their campaigns by providing evidence to enable them to effect change and improve the lives of people affected by cancer. As Impact Champion within health sciences, I have worked with and supported colleagues developing impact case studies, and the value of policy engagement and being able to demonstrate that research has had an impact on policy has been really important in the development of those case studies. We've had support from PPS in a number of ways. So we've had support from the beginning of projects, working with us on strategic advisory groups, for example. But also when we're applying for grants, we, where appropriate, have worked with PPS as a collaborator on those grants, so that we embed the policy work in the grant applications. And the consultation I mentioned with the House of Commons Health and Social Care Select Committee, I think it's fair to say that we perhaps wouldn't have had the confidence to put in our evidence without the really invaluable support of the PPS team, and particularly Wasim, who was a research fellow at the time, because it really supported us to craft the wording and how to shape the response so that it was considered by the Select Committee. And that has been really valuable for the team. But then the result of that being that the evidence was cited in the report and had a prominent place in the report from the expert panel has been really fantastic for the team, that the research that we're doing is having a real impact and supporting and highlighting the needs and of people living with cancer, and identifying this as an important priority for change. Engaging with policymaking might feel daunting at first, so I would highly recommend obtaining or having a conversation with somebody at Public Policy Southampton, or attending one of the many seminars and that are available within the university around impact and how to engage with government. I would also suggest that people engage with the stakeholders, or think about the stakeholders that they engage with throughout any research project, and really think about who the people they need to include might be that can support policy engagement.